June is Men's Health Month, and while most men say they do want to stay healthy for themselves and their families, a recent survey found only about half of them are getting regular checkups and recommended screenings.
So joining us today to talk about why and some of the impacts of that is Dr. Mohammed Makkouk with Baylor Scott White Health. Thank you so much for joining us yet again, Doctor.
I know. Thanks for having me back.
Okay, so let's talk about this a little bit. What about that are you seeing in your practice? Is that on track with what you're seeing at the hospital?
Unfortunately, it is. And so most men, when surveyed, will say they do care about their health, taking care of themselves for themselves and their family, but only about 50% are actually going to the doctor for their annual checkups and doing the screening tests that they need to do. In the hospital, it becomes a major challenge because a lot of times when we're seeing them in the hospital, they have a disease that's advanced to a more severe form, whereas if it had been screened and detected earlier on, it could have been treated fairly simply.
Mm-hmm. Why do you think that is? Why do you think men are holding off on this preventative care until it's exacerbated?
That's a great question, and there's a lot of reasons. The most common ones that I hear from men, one is fear, that they don't want to get a diagnosis because they don't know how they're going to react to that and how they're going to deal with that. Another one is this cultural norm of men of being tough. I'm going to tough it out. You know, yes, I feel bad about something or I'm worried about something, but I'm just going to bury that down and not think about it. And another one is that they're busy. They're taking care of their work, their family, all these other obligations, and they don't necessarily value their own health and putting themselves as a priority in that.
So talk about what screenings you would recommend. I'm sure there's a lot, but if there are just a few that men should absolutely put back into that rotation, in spite of some of those fears, the busyness, what would you recommend?
Yeah, for most men, it's going to be as simple as a once-a-year annual physical exam, routine blood work. And so common things being common, so high blood pressure, high cholesterol, diabetes, these are things which we can easily diagnose and easily treat with medicines and lifestyle changes. When we don't diagnose those early and treat them, by the time we see them in the hospital, they're having heart attacks, strokes, sometimes they're ending up on dialysis. And so those are the most heartbreaking cases because the screening there was easy, the opportunity to treat was easy and prevent that. Aside from those medical conditions, things like cancer. And so most common cancers for men, prostate cancer being number one. So 1 in 8 men will develop prostate cancer. Screening there again is something pretty straightforward and simple. Second most common cancer is lung cancer. And so especially in men who smoke, who are over the age of 50, getting screened for that could be as easy as just a 5-minute CT scan of the chest. And then colorectal cancer. And so this is one that we're seeing more and more in young people. And so the old school medical mentality was colon cancer was a disease of older people. That's not the case. And so now we're seeing people in their 30s and 40s developing colon cancer. And so that's one that's really, again, easy to screen for with colonoscopies. We detect a polyp that we can remove in 2 minutes, and that prevents someone from having cancer 5 years down the road that would need chemo and radiation and colon surgery, and so the screening there becomes really important.
What is your message to younger men? Because my dad, he goes all the time to the doctor. He's always telling me about him going to the doctor. But my husband is much less likely to go. He's almost a mentality that doesn't need to. What would be your message to those people in their early 30s who are putting it off because they don't think they need to?
Yeah, it's a hard message, and I struggle with this myself, and so it's easier said than done. But knowing that we want to be around for a long time, we want to be there for our families, we want to be able to provide and take care of other people. But a big part of that is taking care of ourselves. And so I've seen this with so many of my patients and even my own family members. They get so wrapped up in taking care of other people that they forget to take care of themselves. As a result of that, they develop health conditions that they're no longer able to take care of themselves or other people. So knowing that we want to be in this for the long game with a high quality of life, investment of a little bit of time and energy when you're younger can lead to a lot of really positive benefits down the road.
We talked about some of the negative impacts of delaying care, but talk a little bit more about those positive impacts of catching those things early. How big of a difference could catching something like a polyp early mean for someone?
Yeah, it's huge. So small problems tend to have small, easy solutions. Big problems tend to have big, messy solutions, and a lot of times those solutions are not going to be complete. And so with forms of cancer, when we detect a small area that we can remove, that prevents that from then metastasizing. So most of these cancers are slow growing, and so we have a lot of opportunity through screening to pick them up in that slow growing phase before they become metastatic, meaning they spread to other places, they invade tissues. Once they get to those later stages, the treatment has to be more dramatic. And so that's cutting out pieces of the body, which we don't like to do, or using chemo and radiation, which we don't like to do. And so catching them early, removing those dangerous bad areas before they become a big problem, just solves so many problems down the road.
Such a great reminder this month as we try to raise awareness about men's health. Dr. Makkouk, thank you so much for being here.
Thank you for having me.
We really